watching. And remember, you can find more information on Dr. Morgan's website at www.drjudymorgan.com.
Thanks for watching.
Oh, oops. Okay. Well, I have the ending instead of the beginning. You know, whatever. Close. Well, good. It'll be right when we're at the other end. Morning, everyone. Yeah, our cupboards are pretty bare. Our shelves are pretty bare. Our rooms have boxes because a lot of our furniture left over the weekend.
But our lives are full.
Crap. We still have so much to do. So today we're going down to the title company to sign the deed and paperwork for this house, even though we're not going to be here on the day of settlement. So we have to do that. Hugh's closing out one bank account. The others will close later. It's just fun. So for those of you who see my personal page, you probably saw that on New Year's Day, we started our year with a three-legged cat. Mittens somehow managed to get out and not come back in on New Year's Eve. And he was out for the fireworks, and I don't know what happened, but he came in three-legged lame. And I was thinking, oh, good, maybe he's just got a little abscess, got in a tussle with somebody. Oh, no. He couldn't have something that simple that I could just treat. He ruptured his cruciate ligament in his right hind leg. So in the way that I diagnosed that was allergic flea bites. Your dog has fleas, and apparently they like you too. Oh, how terrible. Stimulus check deposited? We didn't get a stimulus check. But the way you diagnose an anterior cruciate ligament is grab the top part of the hind leg around the femur, right above the knee, and the bottom part. And normally it should be a stable joint, but when it's unstable, you can take the bottom bone and push it forward. And so I was able to do that with him, and he complained and hissed at me. So we have a completely ruptured, I am located in New Jersey, but by Friday night, it'll be North Carolina. So he's got a completely ruptured ACL, which means it's not going to heal. And it's probably going to be, it is going to be a surgical fix. And it's going to be a surgical fix in North Carolina because we don't have time to get it done here. And the three cats are locked in an upstairs bedroom with a bunch of boxes and some cat beds and food and litter, because can you give raw berry boost to your dogs all the time? Yeah, we do. So we want to make sure that the cats are all in the house and in carriers when it's time to leave on Friday morning. So they were locked in a bedroom for the entire week. They're really unhappy. Yep, it's the drawer test. It's the anterior drawer test. So yeah, so Mittens has a ruptured ACL. The other thing I wanted to talk about is somebody had messaged me, and they have a dog that I saw for mast cell tumor, which it had removed, and with clean margins. And we put the dog on my herbal and supplement and diet protocol for mast cell, which is about 7 different herbs and supplements that we give for that. And so it's been about 6 months, and I had told them initially that we would use those for 6 months. So they sent me an email and said, well, should we continue those or can we stop? So a couple of them, I said we should continue. So the antioxidants like the CoQ10, the omega-3s, and the rest could be stopped. But the other problem, never saw a feline ACL. Me either. 34 years of practice, never saw one, and my cat doesn't. Gotta love them. Especially since I didn't do that surgery even in practice. So it's, I don't have a relationship with any veterinarians in North Carolina, and I'm not going to get any discounts, and it's going to stink. But so the dog has been mast cell tumor free, as far as I know, for the past 6 months. No reoccurrence in that area, no new lumps or bumps. So that's all really good. So based on that, and it's a youngish dog, I think. So based on that, I would say, yes, we could stop a lot of the herbs that we've been giving. The problem is the dog is also due for vaccines. And, certainly for distemper parvo titers can be done, so we don't have to give those vaccines. Rabies vaccine kind of depends where you are, whether or not you can get an exemption. If that was a patient of mine, it would get an exemption because mast cell tumors are the immune system gone awry, and we don't want to set that immune system off again. So, yes, Gwen, I was going to ask you where Mila's surgeon is, because I figure as soon as we get down there, I'm going to have to call and make an appointment. So now lepto and Lyme vaccine, that's a different story because lepto we know only lasts for 9 to 12 months. So I don't like the lepto vaccine based on, this is a large dog, so it's going to be less reactive. But based on exposure, that's how you would determine whether or not your dog really needed to get the lepto vaccine. These people do hike and hunt with their dog or are out in the fields a lot. So lepto might be more important. I don't know. I don't remember where they live, but I would have to look at the occurrence rate in that area to decide whether or not it would be worth pursuing that vaccine. But the Lyme vaccine is only 60 to 80% effective as a vaccine, period. It's about 80% effective if you start as a young puppy before the dog is exposed to Lyme. If they've already been exposed to Lyme or had Lyme disease, then the vaccine is only about 60% effective. The other problem is that there's about a dozen tick-borne diseases. Lyme is only one of them. So giving a vaccine for one doesn't protect you from any of the others. So in my mind, and Lyme is very treatable. So in my mind, it's a vaccine that doesn't have a lot of use. The other thing is that when we run our Accuplex, which is the heartworm, Lyme, Ehrlichia, and Anaplasma, that's how it's called the 40X or the Accuplex. That's what's generally run when you get your heartworm test. It's pretty rare to see just a heartworm test run unless you live in an area where you don't have ticks. But most of this country does have tick issues. And on the Accuplex that we send out to the lab, the results will come back as negative for vaccine and exposure, positive for vaccine antibodies, or positive for exposure or disease. And it can be acute or chronic, meaning it's a new or a long-standing problem. And what I saw in practice was dogs that had a Lyme vaccine 8 to 10 years ago were still coming up positive for vaccine antibodies. Now, that's not the same as a titer, but that means there are antibodies floating around in the dog's system. And if they are exposed to Lyme disease, their body has memory of that, and their body will start attacking the Lyme disease organism. So in my mind, what I know about immunology, which, hey, we all had to take that, if the antibodies are there and the dog's immune system is working, why would you give another vaccine? It's sort of like if you have a positive titer for distemper and parvo and rabies, why would you give another vaccine? So my recommendation would be don't give the Lyme vaccine to this dog. It's not a very effective vaccine. The dog may still have tons of antibodies floating around. And the answer I got was, well, I can't find any literature online that says that the Lyme vaccine lasts more than 1 year. No, you're not going to find that. And guess what? The company's not going to do the research on that because they want you to buy the vaccine every year. So if I had a dog with mast cell tumor, I would be avoiding vaccines like the plague. And my recommendation would be that this dog not get the Lyme vaccine. My recommendation would be to think long and hard about the lepto. And if we are going to give both vaccines, we are going to give them very far apart, so at least 3 to 4 weeks apart. How can you tell if a dog has recovered from lepto? Well, interestingly, I only saw half a dozen cases in 35 years. It's just not that common. And that's part of the problem. It's not that common, but the veterinarians, if they see one case, they want to vaccinate the next 3,000 dogs that walk in the door. We had one dog, a Bernese Mountain Dog, that got it at a dog show. And he lived a normal lifespan. His kidneys were not good from the time he was about 3, but he lived to be an old dog because his mom was very, very good about diet and being holistic with everything. I had a shepherd who was exposed at a young age, and she seemed to never really recover from it. She would have bouts of bloody urine. She had some really weird things, liver enzymes that would spike up once a year or so. Again, died at an old age as an old dog and was exposed young, but she had problems that we had to deal with every year. So, it's different for every dog. And then I've had other patients that have died acutely of lepto because they weren't detected early enough. So, for animals that have cancer, for animals that have immune systems that are out of whack, be very, very careful with vaccines because that is stimulating the immune system. That is giving the immune system a job to do. And when I see a dog with cancer, I tell the owner, look, his immune system has a big job right now. His immune system is working on something really important, really important. And I'd much rather have the immune system working on that than playing around with a vaccine that wasn't needed. So, okay, everybody have a wonderful day. We have like a million things on our plate still, even though almost, I would say 99% of everything we own is in a box. Boxes everywhere. Maybe I'll go around the house and take pictures of the stacks of boxes. It's crazy. So, okay. Alrighty. Everybody have a wonderful day. Maybe the music now, since it's the ending music, maybe now we'll get the right music. All right. Supporters, I don't know if we'll get anything in this week or not. We'll see. Maybe. My laptop doesn't get packed till the last minute, so we'll see. Maybe. We're trying to drink up all the alcohol so we don't have to transport it. Doing a darn good job. We emptied out 4 bottles last night, but they were all bottles that had this much. I'm not moving bottles with this much in them. We dumped some, and my mom said, "What are you doing dumping good alcohol?" Unloading stuff as fast as we can. Yeah, last night we had 2 gins mixed together. And the night before we had 2 vodkas mixed together. It was okay. We're not very picky at this point. We're just...
Thanks for watching. And remember, you can find more information on Dr. Morgan's website at www.drjudymorgan.com.
Well, I'm glad to see we were inspiring people. Debbie Schwartz says they're making a goodwill run. So, yeah, purge, folks, purge. You don't want to have to do this all at once. Have a great day.